Robert Mitchell, age 75, was healthy. He never missed his annual checkups. Every weekend he went hiking. He was someone who cared about his health more than anyone. Then one day, during a routine screening, they found a small abnormality. The doctor said, "Nothing to worry about. We'll just keep an eye on it." But Robert couldn't stop worrying. Hiking? He quit. What if it puts too much strain on my body? Sleep, gone. Every night that abnormality haunted him. His happiness disappeared. A healthy man had become a patient. And then months later, the truth came out. That abnormality wasn't a disease. It was just a normal part of aging. Something that naturally happens as we get older. Robert's story could happen to almost anyone over 60. As we age, we think, shouldn't I get more tests? Shouldn't I catch any disease early just in case? But the reality is far more complicated. After age 60, some screenings save lives, but others bring unnecessary stress, additional procedures, and enormous costs without actually improving your health at all. I'm Dr. James Anderson. I've been an internal medicine physician for 50 years, and I'm now 74 years old. As both a doctor and a patient, I've come to an important realization. The real question isn't, how many tests can I get? It's, which tests truly help? Today, I want to share screenings that can actually harm you, especially if you're a healthy adult over 60. This doesn't mean never get them. It means pause, ask questions, and make sure that test is right for your situation. Let's start with the first one, the full-body PET-CT scan. Catch cancer early. That's what the advertisements say. Sounds appealing, right? But here's what most people don't know. When PET-CT scans are done on people without symptoms, studies show that nearly all the findings turn out to be false alarms. What does that mean? More scans, invasive procedures, weeks of anxiety, and in the end, no disease at all. On top of that, PET-CT exposes you to significant radiation, which carries its own risks. So should you never get one? No. If your doctor suspects cancer based on real symptoms or other test results, a PET-CT can be essential. But as a routine screening, just in case, think twice, or even 3 times. Before we continue, if you found this helpful, please hit the like button and subscribe to the channel. I'll be sharing more truths to protect your health. Now let's move to the second test. This one is especially common when loving family members encourage you to get checked. The next test I want to talk about is the routine echocardiogram or heart ultrasound. I hear this all the time. My kids want me to check my heart. I feel fine, but they just want to be sure. It usually comes from a place of love. Adult children see their parents getting older and think, why not get every test possible? What could it hurt? But here's the thing. In people with no symptoms, routine echocardiograms often do more harm than good. Let me tell you about David Chen, 68 years old, from Seattle. David was the picture of healthy aging. He walked 3 miles every day, worked part-time as a consultant, loved playing with his grandkids. He felt strong, energetic, and happy. For Father's Day, his daughter surprised him with a premium health screening package. Out of love, she wanted reassurance that her dad's heart was strong. It included an echocardiogram. The result came back, mild mitral valve regurgitation. In plain English, one of his heart valves leaked a little. The doctor reassured him. This is mild. We'll check again in a year. Nothing to worry about. But David didn't hear nothing to worry about. What he heard was, your heart is broken. He stopped exercising. The man who walked 3 miles every day quit. Ironically, that made his health worse. He lost confidence, grew anxious, and started to feel like a patient instead of a healthy man. A year later, the follow-up test showed no change at all. The cardiologist explained, This is common at your age. It's like gray hair or wrinkles, just part of normal aging. Most people your age have some valve leakage and it rarely needs treatment. Here's the truth. Echocardiograms are life-saving when you actually have symptoms. Chest pain, shortness of breath, fainting, swelling in your legs. In those cases, an echo can reveal serious heart problems that need treatment. But as a just-in-case screening, it often finds things that sound scary, but are completely harmless. So what really protects your heart as you get older? It's not routine echoes. It's managing blood pressure, taking medications as prescribed, and staying active. And here's something simple but powerful. Take those walks with your family. Share meals together. Encourage each other to stay healthy. That does more for your heart than an unnecessary test ever could. Now let's move to the third test, and this one sounds so appealing, so simple. Tumor marker blood tests. Maybe you've heard of them. PSA for men, or CA19-9, or CEA. The idea is tempting. Just a quick blood draw, and you'll know if you might have cancer. On the surface, it feels harmless. Who wouldn't want that kind of reassurance? But here's the problem. These tests are terrible for screening people who feel perfectly fine. Let me tell you about Susan Williams, 71 years old, from Miami. Susan saw an ad for a convenient cancer screening at her doctor's office. She thought, it's only blood work, what's the harm? So she added a panel of tumor markers to her annual checkup. When her results came back, her CA19-9 level was slightly elevated. Her doctor explained that this marker can sometimes be associated with pancreatic cancer. 2 words, pancreatic cancer. That was enough to shake her world. Overnight, Susan went from feeling perfectly healthy to feeling like a ticking time bomb. She couldn't eat. She lost sleep. Her family began preparing for the worst. For months, she endured CT scans, MRIs, even an endoscopic ultrasound, each one searching for a cancer that simply wasn't there. Finally, after everything came back negative, the truth was clear. Her elevated marker came from mild stomach inflammation, not cancer at all. Susan told me later, I was healthy before that test. The only thing it gave me was months of fear and thousands of dollars in bills. And sadly, she's not alone. Here's what the research shows. In healthy people with abnormal tumor marker results, fewer than 3% actually have real cancer. That means 97% are false alarms. False alarms that lead to sleepless nights, endless testing, and financial burdens stretching into tens of thousands of dollars. And the emotional toll, it's immeasurable. Once someone hears the word cancer, it's hard to ever feel at peace again, even if every scan says they're fine. Now let me be very clear. Tumor markers do have an important role in medicine. If you've already been diagnosed with cancer, these tests can be useful for monitoring how well treatment is working or for catching recurrence. But as a way to screen healthy people just in case, they create more harm than benefit. So what should you do instead? Focus on screenings that are proven to save lives, colonoscopies and mammograms, and invest in the everyday habits that really matter. Don't smoke. Keep alcohol in moderation. Eat a diet rich in vegetables and whole foods. Stay active. Prevention doesn't have to be complicated. It can be as simple as a daily walk, cooking meals at home with your family, or joining a local exercise class that also keeps you socially connected. Those things cut cancer risk far more effectively than any tumor marker blood test ever could. And let me pause here for a moment. If this story opened your eyes, if it made you rethink the idea of simple tests, please hit that like button and subscribe to the channel. Have you ever had a false alarm medical test that scared you more than it helped? Share your experience in the comments. Your story could save someone else months of unnecessary fear. Now let's talk about the fourth test, and this one especially affects women as they get older. Bone density testing. Now let me be clear. Bone health is incredibly important. No one wants to deal with fractures in their 70s or 80s. But repeating bone density scans too often, or rushing into medication just because of a single number, can sometimes create more problems than it solves. Take Margaret Davis, 73, from Boston. Margaret was the kind of patient every doctor admires. Active, careful about her diet, always following medical advice. For nearly 10 years, she had a bone density test every single year. One year, her results dipped just slightly below the so-called osteoporosis line. Her doctor grew concerned and immediately prescribed medication. She began taking a drug meant to strengthen bones. But almost right away, she developed painful side effects: severe heartburn, trouble swallowing, constant discomfort that made eating miserable. Margaret, who used to enjoy dinners with friends and neighborhood gatherings, started avoiding them altogether. She lost weight, grew more isolated, and became discouraged. In her own words, "I thought I was protecting my health. Instead, I felt like my world was getting smaller." Here's the part many patients don't hear. After age 75, muscle strength and balance are often more important than the bone density number itself. The scan doesn't always tell the full story. Medications like bisphosphonates can help in some cases, but they don't always deliver the benefits people expect in older adults. And the side effects can sometimes make life worse rather than better. So what's the right approach? Medical guidelines are clear. Most women over 65 only need one baseline bone density test. If the result is normal, you don't need another one for at least 5 years. Annual testing simply isn't helpful. What's more, starting medication based on a single borderline result can put people through years of discomfort without actually reducing fracture risk. What really prevents fractures? It's not just the numbers on a scan. It's the everyday habits that keep your body steady and strong. Strength training a few times a week, balance exercises like Tai Chi or yoga, daily walks. These can all reduce fall risk dramatically. Small home adjustments also go a long way. Adding night lights in hallways, securing rugs so they don't slip, wearing shoes with good support, and don't forget nutrition. Calcium from food, vitamin D from sunlight, and protein to maintain muscle. These changes together cut the risk of falls and fractures by more than 60%. Margaret told me later, "I thought I was doing everything right by testing every year, but I realized that my best protection wasn't another scan. It was moving my body and staying steady on my feet." Her story is a reminder that health isn't about chasing numbers. It's about building resilience day by day. So if your doctor suggests another bone density test every year, or if you're being pressured into medication after a single borderline result, pause and ask, will this really change how I'm treated? Or would my time and energy be better spent on staying active and preventing falls in the first place? A regular checkup with your primary care doctor, combined with a thoughtful conversation about your risks, is often far more valuable than another scan. Now, after hearing about all these tests you should think twice about, you might be wondering something important. Okay, then what screenings actually matter? Which ones should I keep doing to protect myself as I get older? That's the most important question, because the answer is not skip everything. There absolutely are screenings that save lives, and they're often not the flashy, expensive ones you see in ads or private health packages. Let me start with colonoscopy. I know nobody likes the prep and nobody wants to take a day off for it, but colonoscopies truly do save lives. Colorectal cancer, when caught early, has a cure rate of over 90%. And unlike many screenings, a colonoscopy doesn't just detect cancer. It can prevent it altogether by removing polyps before they ever become dangerous. I'll never forget George Harris, a retired teacher from San Diego. He avoided colonoscopies for years, always saying, "The prep is too unpleasant." Finally, after persistent encouragement from his doctor and his family, he agreed to go through with it. During that procedure, they found a polyp that was already showing early changes toward cancer. The doctor removed it right then and there. George didn't need surgery, didn't need chemo, didn't need radiation. That test, uncomfortable as it was, literally saved his life. George later told me, "That one day of inconvenience gave me 20 more years to spend with my grandkids." Now, mammograms are another important screening for women. Patricia Martinez from Houston finally agreed to a mammogram at her daughter's urging. They found a small tumor, caught it early, and she was able to treat it quickly and return to her normal life. For her, that single screening meant she could stand proudly at her daughter's wedding just a few months later. Sometimes one test at the right time can give a family its future back. And then there are the basics, the ones people often overlook because they sound boring. Blood pressure, cholesterol, and blood sugar checks. These three numbers are behind more heart attacks and strokes than most people realize. Managing them properly with medication when needed can add years of healthy life. In fact, for many older adults, keeping blood pressure under control does more to prevent stroke than any high-tech scan ever could. So here's what I recommend. Keep up with your annual wellness visits. Get your blood pressure, cholesterol, and blood sugar checked regularly. Talk to your doctor about colonoscopy and mammograms if they apply to you. These are the tests that change outcomes, that prevent disease rather than just create worry. And of course, combine these with healthy habits. Staying active, eating balanced meals, keeping alcohol and smoking in check, and maintaining meaningful connections with others. But don't underestimate the medical basics. A simple blood pressure cuff in your doctor's office may be more powerful than a $1,000 scan. I think of Dorothy, 82 years old from Chicago, who once chased unnecessary tests for years. When she finally shifted her energy into walking groups, volunteering, and friendships, she told me, "Doctor, I feel healthier at 84 than I did at 79. She was living proof that real health is built on the right screenings paired with the right lifestyle. So here's the message. You don't need every test. You need the right tests at the right time, plus a commitment to simple, proven habits. That combination gives you the best chance for a long, active, and meaningful life. Now let me bring this all together. Before we wrap up, let me give you something practical. When your doctor recommends a test, here are 4 questions that can change everything. 1. Do I have symptoms that suggest I need this test? 2. How will the results change my treatment? 3. What are the risks of the test itself? 4. What happens if I wait or choose a different approach? Write these down. Keep them in your wallet. A good doctor will respect these questions. A great doctor will thank you for asking them. So now that we've walked through all of this together, let's step back and look at the bigger picture. Health after 60 isn't about piling on more and more tests. It's about knowing which ones truly protect you and which ones only add stress, bills, and sleepless nights. And it's about remembering something very important. You are not powerless in this process. You get to decide. When I look back on 50 years of practicing medicine, the hardest stories I've seen weren't always about disease itself. They were about healthy people suddenly living like patients because a test whispered a scary word like abnormality or suspicious. Overnight, their peace of mind was gone, even though nothing was really wrong. But I've also seen the opposite. I've seen people like George whose colonoscopy removed a polyp just in time. That single screening gave him decades more with his grandkids. Or Patricia, whose mammogram meant she could walk down the aisle at her daughter's wedding healthy and smiling. Those are the screenings that matter. And then there are people like Dorothy from Chicago. She told me, "Doctor, I feel healthier at 84 than I did at 79. Why? Because she stopped chasing every test and instead started chasing life. Morning walks with her friends, new hobbies, volunteering at her local school. Her health improved not because of more scans, but because of more living. That's the part I want you to remember. Instead of another unnecessary scan, maybe spend that morning walking with your granddaughter. Or picking up the phone to call an old friend you've been meaning to reconnect with. Those moments are not just pleasant. They build real health, lowering stress, strengthening your heart, and giving you reasons to stay strong. And I know it can feel intimidating when a doctor in a white coat says, "You need this test." But you have every right to ask, "Do I have symptoms? How would this change my treatment? What are the risks? Are there alternatives?" A good doctor will welcome those questions because good care is a partnership, not a checklist. At the end of the day, medicine has its place, but it's not the whole story. Living well through movement, connection, good food, and joy is the foundation of health that no prescription can replace. So here's my invitation to you. Before you agree to another test, pause. Ask yourself, am I doing this out of fear or because it's truly necessary? Then consider investing that time and energy into living fully instead. Thank you for spending this time with me today. I hope this video gave you not just information but reassurance that you don't need every test to stay healthy. You just need the right ones and the courage to keep living your life. And if this message resonated with you, please subscribe. Not just for more videos, but for reminders that health is about living, not worrying. Hit the like button if this encouraged you and share your story in the comments. Your words might be exactly what someone else needs to hear today. Subscribe and turn on notifications so you don't miss it. Remember, health isn't about worrying. It's about living. I'm Dr. James Anderson. Thank you for watching.